So talking about the basis of MCCQE1, so we are going to talk about MCCQE1. First of all, I would like to introduce myself. My name is Dr. Kainat, and I have already passed both of my exams, so that's why I'm helping you guys. So first of all, talking about MCCQE1, this is the first step that you need to get into the system here. So this is basically a written exam where there will be CDM questions and MCQs. If you talk about basis of MCCQE1, there is no shortcut to MCCQE1, whichever pathway you are choosing, like PRA, if you are choosing MLPIMG program, if you are choosing any pathway, you are still eventually have to give MCCQE1 in later years or even right now for CARMS. So what is the basics of the MCCQE1? It is basics exam uh, which is going to be tested on the basis of MCQs and CDM questions. So what is MCQs? MCQs is just like the usual one, choose between 4 or 5 options. And there's some time in the options, there are 2 or 3 answers that is actually you are finding it correct. Let's suppose if you go by hypertension example, if the patient is having a hypertension, which kind of the medications you are going to choose for the treatment of hypertension, there might be 2 or 3 options that is already being the same, like beta blockers, calcium channel blockers, ACE inhibitors, SGLT2. So the answer you are going to choose is basis on the what is given in the scenario and the most best one. Like talking about beta blockers is the best one and the first line. So you are going to choose between all of those ones, the best and the most appropriate ones. Not just knowing the antihypertensive, but the best and the first line is more important in choosing of the MCQs. Coming to CDM, CDMs is the most tricky part, and a lot of people make problems with the CDM, and that's why unable to pass the exam. CDM is very crucial or very important part of the exam. CDM might have to write in or choose from the options, and people have confusion in regards of the choose from options or what should I write down. CDMs are very tricky and hard to understand, so you have to be very appropriate while answering these CDM questions. So CDM question, when you are writing it down, what happen is you have to choose what they are giving, and on the basis of the scenario you have to analyze what you are going to write down. But from the options that is given, you are still not sure what are you going to do next. Either you are going to admit or this patient needs IV line right away. So sometimes the answer is the one they are looking for in their key. If let's suppose they have given you write up to 3 or choose up to 3 and their answer is in the key is 1, so you need to write down 3 just in case, but you don't know the key at this point. That's why your one answer should be in line or in the key of their answers. So that's why you will get the points. Even if you write 3 options and one of the answer is correct, as soon as you don't write something which is basically, harmful for the patient, you will get marks for that. For more CDM question, examples and how you are going to write it down, I'm going to conduct a course, so you can join that, and I will definitely like to answer every single things that you need to know about CDM. Coming to the next one, make an account on physician supply. So basically, if you have to start or thinking about how to start, so you have to make an account over there, pay for the document attestation, which documents you need, degree, SVR, and passport, almost take 2 months. And after that, you can book your exam. Now coming to the next one, how you prepare for MCCQE1. Use a basic book. Let's suppose you are talking about Toronto Notes, MTB, First Aid, whichever book you want to choose. It's totally up to you. Use a basic book and practice MCQs and CDM. You can choose MCQs as a CDM question too. Let's suppose if you hide the answer, it will become CDM question. So you can choose MCQs, and on the base of that, you can practice CDM as well. Stay motivated. Surrounded yourself with the people who are about to give or at least giving the exams. That's why you will stay motivated and want to do the exam as well. Okay. If needed, take small courses, because why I'm saying this will help you to start in or actually give a kick in to start the MCCQE1 preparation. They will give you a better idea. Let's suppose if you start as a beginner course with someone, they will give you a rough idea how MCCQE1 works, and then later on you can study by yourself. It's not like the course is going to give everything into you in your whole thing. But for the course, that will give you a little motivation that along with you, there is so many people who are studying, and along with that, this will also give you a rough idea where you need to start and how you need to study. It's very important that you don't do every single thing. You need to do the important things, and how you need to study is very, very important in MCCQE1. By MCC practice test, very important, test your knowledge and then book the exam. And so sometimes people, what they do is they buy the MCC practice test first and see where they're standing and then start working from there. You can also do that if you want, but You can study first and then test yourself and book the exam. That is also one of the way. Resources of MCCQ1, Toronto Notes, UWord, ASQ Bank, MCC practice test. There are MTB, there is a first aid, there is emboss. You can use all of those things, whichever you need. This is what I use. That's why I'm giving you the references which I used and find it helpful. How much time do you need? Almost 6 to 7 months you need to study approximately. And when you are giving enough time, then 6 to 7 months. Don't rush the exam. You don't want to fail this exam. It's already $1,300 and you don't want to waste your money. Only take when you are ready. I mean, that's what I'm saying. Don't rush the exam. Sometimes you did one read and you feel like everything is done. Now I'm going to take the exam. That's not how it works. You need to study. You need to evaluate yourself. Sometimes even you need to take courses to understand CDM questions. Then you are going to write down the exams. You don't want to fail the exam, or you don't want to get less marks, because this is how you are going to be evaluated in CARMS. How many hours a day? Almost 4 hours are required. You can give more than that, you can give less than that. It's totally up to you. You can divide time. Let's suppose if you are giving 4 hours in a day, divide that 2 hours for MCQs and 2 hours for studying of Toronto Notes. So you have to divide this just like that way. Do Toronto Notes in morning and solve MCQs in the night to test your knowledge. It's very, very important. Now coming to the next, can you do job before MCCQ1? Definitely, there's some provinces that give you job without MCCQE1, but on the same time, it varies in the provinces. Some do need your test and then you can do the job, especially in the healthcare. I'm talking about healthcare. Vary from provinces to provinces. Some do let you do job and some don't. So if you want to do the exam, it's even better. Let's suppose if you don't take the exam and you want to do work, you will be not able to give sufficient time to QE1 and you will be just keep on lagging behind. That's what I'm saying. Just give the exam, get over with it, and then start the job. This is also one of the very good way. Do I need to do everything from Toronto Notes? No. Remember, Toronto Notes is not your syllabus. MCC objective is your syllabus. So you are going to follow the topics on MCC objective and then do those topics from Toronto Notes. Toronto Notes is your textbook to study. At least do all the MCC objective. There is no shortcut of it. Okay. There is no shortcut to MCCQE1. There is no big nine, there is no such thing. There is 210 MCQs. Do you think they will only test 9 topics? No, they will test every single thing. If you don't want to fail or you don't want to get bad marks, you have to eventually study every single thing. I'm not talking about Toronto Notes. You need to study every single thing from MCC objectives. Why use Toronto Notes and not MTB? Why I'm saying this? Because Toronto Notes is basically based on the Canadian guidelines. So you need to see, because MTB and first aid is based on the American guidelines. There is minor differences between American and Canadian guidelines. So you have to eventually follow the Canadian guidelines. If you still feel like MTB and first aid is enough, go with it. I'm not saying use Toronto Notes. It's totally up to you, whichever book you want to study. It's just based on the guidelines. You need to follow the Canadian guidelines. In the end of the day, they are going to test you how much you know or updated with the Canadian system, not with any other system. Coming to the next, that's what I was talking about. I'm going to start a course for 7 days, and this is I'm going to do the 5 basic topics. Which are the 5 basic topics I'm going to do? Emergency medicine, family medicine, then obstetrics, gynae, and then general surgery. So I'll be cover that in 7 days and try to answer all of your CDM questions. For internal medicine, I will make videos and put on YouTube so you can follow from there. That will be totally cost free. I'm going to make a group and then pay attention to if everyone, whoever is needed. Charges will be $200 and it's starting from this Sunday, and class will be at least for 3 hours long. I will try to answer all of the CDM questions. I will try to answer all of the questions from all over the book. It doesn't have to be just from this specific topics. These specific topics will be covered and on the basis of the CDM discussion. Whoever is interested can message me and I'll definitely let you in. So this is the eventually course that I'm going to do. After that, I won't be doing any course for a while. So this is just an request from a lot of people. That's why I'm doing it. So whoever is interested, kindly let me know. Okay. So I hope I answered all of your questions you want to know about MCCQE1. If you still have any question, feel free to comment below and I will definitely answer those. Thank you so much.